Speaking with the Chief Medical Director, Irrua Specialist Teaching Hospital, Professor Silvanus Okogbenin, who said that though Lassa Fever outbreak is recorded yearly, this year cases have been considerably managed due to the preparedness of the staff of Lassa Fever Institute. Professor Okogbenin said out of the 5 mortality recorded so far, only one of the patients spent about an hour before passing away.
We should have about 20 patients in the ward, and some of them are doing very well. And there's some others that are not doing very well. Some others have complications. But we're managing all of them at this point in time. National target is 10%, but the mortality is in here is much lower than that. And we are trying to make it even better than that right now. This year seems to be better than many previous years. And that's because, of course, now we know the season when it's coming. So we expect it and are better prepared than many years ago.
While reiterating that Lassa fever disease is real and can be contracted from deposits of rats who find their way from the bush into homes due to scorching sun, bush bunny and other factors, he said there is need for personal hygiene. He also advised residents to report suspected cases to the hospital, especially when symptoms of common fever persist after 48 hours for proper diagnosis.
Avoid contact with rats as much as possible. Make sure that the holes where rats enter your houses are plugged or blocked. Make sure you don't keep refuges around your houses, because the rats will come to those refuges and then they can easily enter your house. Then make sure that your food are well protected. You can use rodent-proof containers to cover your food. And then when you want to eat leftover food, it's best you boil or you reheat the food. That will make sure that any virus or bacteria inside is killed. Then once you have a fever that is unusual, particularly when it's not responding to anti-malarials and antibodies and antibiotics, within 48 hours, if you present to the hospital, then you can quickly have a diagnosis. And if it's Lassa fever, it can be treated.
Professor Okogbenin said that with the outbreak of COVID-19, the hospital is more than before ready to combat viral diseases. He expressed optimism on the possibility of having vaccine for Lassa fever. Ferdinard, Osakwe, reporting.